And now we're going to turn it over to looking at more of the status of programs and agencies that target MSM here in Connecticut. And we'll start off with Chris Andresen.
Good morning again, everybody. And I'm going to talk about where we are right now in Connecticut with the HIV prevention funding that we have based on the last round of requests for proposals that the department issued. And I don't remember what year it was now. I think it was 2000. Yeah, it was 2008. Was it 2008? Yes, thank you, Gina. And, you know, a lot of times we issue our RFP. We base the RFP on the priorities of our statewide planning group, and you know we had a lot of conversations that after the RFP process, the way things shake out, you know, we kind of go, ooh, it doesn't feel like all the groups that should have gotten funding got funding, and you know particularly what we'd see is that there'd be a lot of funding that ended up going to programs that targeted heterosexuals, and then groups like IDUs and MSM, there was sort of less programs targeting those groups in proportion to the sort of infection rates within those groups. And actually, a couple years ago, you know, right before we did this RFP, I had been going to the A-Life Committee. If those of you might be familiar with the A-Life Committee, it's Sean Lang and Leif Mitchell lead the A-Life Committee sort of through CARC, and they look at AIDS legislative and funding issues. And we were having a meeting, and we were talking about the upcoming RFP, and Leif was like, you know, oh, I'm just, you know, I'm worried that it's gonna, you know, fall out again in kind of the same way. And I was like, yeah, me too, you know. So how can, you know, and I'm driving back to work, and I thought, well, how can we do this, you know? And one of the sort of criticisms we'd heard at the previous RFP was that what we've done is we've moved towards something called funding primarily what are called effective behavioral interventions. And those are interventions that CDC, that they've been studied, they've been replicated, and they've been shown to actually change people's behaviors. You know, because for many years, we did a lot of programs that, you know, they had good intentions, but because at the time HIV was relatively new, we didn't have a lot of research to back up what we were doing other than, are we reaching people? Are we talking to them? Do they seem to be learning stuff? But we really didn't know if it was leading to actual behavior change, which was is, you know, ultimately necessary to reduce new HIV infections. So, you know, but then on the other hand, when we looked at these effective behavioral interventions, there really wasn't a lot specifically targeting MSM. So there was kind of like this, you know, kind of struggle with, you know, on the one hand saying we are going to fund effective behavioral interventions because they've been proven to be effective, and on the other hand, you know, communities going, you know what, we see them, we understand them, but they're not really going to work in our community because, you know, we're not set up like Chicago or New York or wherever where these things may have been studied. And so, you know, I was driving back and I thought, oh, wait a minute, you know, we have some state funding. Let's take some of that state funding and pull it out of the big pool, and we will target it to those two groups, MSM and IDU. And because it's state funding, it's not tied to our federal grant, we don't have to be so worried about adhering to, you know, these effective behavioral interventions that CDC sort of, you know, really pushes us to use. And if we don't use them, we have to go through this crazy stuff. So it's, you know, I'm not going to go there describing that. But, you know, the state funding actually gave us the freedom to allow communities to kind of be creative. We asked them to do an evaluation if they were going to do something, but that was it. So in 2008, we had two RFPs. One was for $4.5 million for all of the priority populations identified by our planning group, and you had to do the CDC DEBIs, the CDC sanctioned interventions only. And that was broken out by counties throughout the state. We also had RFP number 2, which was for $1 million, which was limited only to IDU and MSM, and you had to do some sort of evaluation with that. But you know, we wanted to give people the freedom to respond to that. And you know, what was a little disappointing at the time was that with the second RFP, I mean, people could do MSM in the first one too, but if you were going to apply for MSM, it had to be doing one of the effective behavioral interventions. So, you know, we had people apply under both RFPs, but with the second RFP, we had, I think, 19 proposals, and 3 of them targeted MSM, you know, so it's kind of like, oh man, you know, this didn't turn out the way we were hoping it would turn out. But these are the results, and this is where we are right now with programs specifically funded to do to target MSM with HIV prevention. In Hartford County, there was, based on the RFP, and this was a very competitive RFP process, I need to put that out there too. We ended up getting, for every dollar we put out, we had $3 requested. So, there was really it was very competitive. But in Hartford County, we had one agency funded, and that's the Hartford Gay and Lesbian Health Collective. They were funded to do HIV counseling and testing, CRCS, which is, oh my God, I totally know this, but I forgot. Comprehensive Risk Counseling Services. Yeah, that works with people that are high risk for HIV to reduce their behaviors. The Empowerment Program, which you're going to hear talk about later on today, and Healthy Relationships. And then on RFP number 2, they were funded to do peer and non-peer outreach. In New Haven County, not actually in the city of New Haven, this is Waterbury Health Department. Waterbury Health Department was funded to do empowerment in New Haven County. And in Fairfield County, we have Interfaith AIDS Ministries who are doing empowerment, and they're in Danbury. And they're all doing a great job, but there's nothing happening in New Haven really right now, and there's nothing happening in Bridgeport, two big cities where, we have a lot of MSM. And there were, I'm not saying these weren't the only applicants. There was another applicant in Hartford County, but because of the competitive nature of the bid, that applicant didn't do it because they were actually proposing to do like an empowerment program too. So, but this one was over there. But looking at what's happened since that RFP, between the 3 programs that are doing empowerment, we've got 136 participants reported to us, and part of what these programs do is they do a lot of community outreach to kind of try to find guys that would be interested in doing it. So they're out there, providing education, et cetera, and then they kind of find a few that are willing to come in and participate in the broader groups. Now, just because people aren't funded specifically to do prevention work for MSM doesn't mean that they might not end up working with some MSM. So I just want to acknowledge that there are providers out there that still do reach MSM. For instance, 143 other MSM were reached through other interventions, identified by 34 different contractors who reported working with them. And I also want to point out too that this data isn't our counseling and testing data. This is just for interventions going out to the community. And my time is running up soon, but I want to talk about a few things that we've done recently. And in September of 09, we held the D-UP training, and that we had some CDC technical assistance providers come in, and that's a training on an effective behavioral intervention for Black MSM in Connecticut. Black MSM, and we held it in Connecticut for our providers. Rob Cruz, who's going to be talking right after me, we had him kind of go out because I had said earlier, contractors kind of saying, we're not sure how to address it, so I wanted him to go out and look a little bit more and talk to providers and find out what are your struggles, what are your barriers, what can we do as the Department of Public Health to kind of assist you in working with this population. And we also started an MSM work group, which actually, based on our discussions in that work group, this conference is a result of that. We need to get people together. We need to show them, there are some interventions that actually can work in a state like Connecticut that doesn't have huge cities with huge, maybe gay neighborhoods or something like that. Coming up is one thing that we have planned. We have a contract with Concerned Citizens for Humanity, and Daryl Decker's here today too, and one of the things he did is this AIDS chair here. But for those of you who know Daryl, he's been working in the field of HIV/AIDS for years and comes up with really wonderful I don't know, you never know what's going to come out of it, so I don't even know what to call these things, but, comes up with things that really kind of bring people together to talk and look at an issue and create like an image or a piece or something that can sort of stand on its own as a piece to maybe influence people, but also can kind of complement the programs that people are funded to do. And, one of the projects we're charging Daryl to work with is to do something with the MSM community. And, I hear from all of our program people all the time. I've been hearing Danielle about a lot of your clients lately, and it just, it's crazy. And, we're hoping we're going to be able to reach out to our programs and say, rather than having us who are in the field, a lot of us in the field doing HIV prevention, to get maybe clients, men who are infected with HIV to say, come on, help us come up with a message that will work in our communities and in your community, that we can spread the word and get it out there. So, in the near future, please expect to hear from us, and we hope that you'll respond and maybe work with your clients, work with the people that you're seeing who are at risk or HIV infected to help us come up with a message that will, hopefully kind of stop what's happening, with HIV and other STDs in the MSM community. And thank you all very much. My time is up. So.